History made. After months of delays, some Ohioans were able to get their first doses of medical marijuana.
News 5's Kevin Barry was in Sandusky this morning as the first sales took place.
The original plan was to have medical marijuana available for patients in Ohio on September 8th. Well, after a 4-month delay, some patients were here long before the sun came up to reserve their spot in line. The long, cold wait before the Forest Sandusky opened could have been a lot worse for Samantha Mans if not for the few space heaters in line. The wait for her was worth it because medical marijuana could help her chronic knee pain. Mans says traditional pain medication made her depressed and the pain strained her relationship with her son.
He's like, "Mom, you're always in pain. I don't understand how to talk to you." So finally, this is the miracle I was hoping for, and he knows it too.
Inez Henningsen was the first patient to make a purchase. She's looking for a new treatment for her multiple sclerosis.
I have an aunt that had MS, and she was severely disabled from a very young age. And I wanted to try to maintain as much of my function for as long as I could.
Inez got just 1 ounce of the medical cannabis a few minutes after the Forest Sandusky opened. For now, the dispensary will only allow patients to buy 1 ounce at a time so that they can help as many people as possible. That's because the stockpile of available product is still low, and the journey it took to get to this point is a long one. Medical marijuana has to be grown in one of just a few approved cultivation facilities in Ohio. Eventually, those plants will go to processors to be made into oils, lotions, among other products, but none of those processors are up and running yet, so patients can only get pieces of raw marijuana plant for now. All forms of medical marijuana have to be tested in a lab to ensure it doesn't violate state law. Finally, it makes its way to dispensaries like the Forest Sandusky, which just got permission to sell to patients this week. That's where Samantha and Inez were able to buy it.
The idea that, I'm taking, lab-created pharmaceuticals and replacing them with a plant.
State law still makes smoking her new medical marijuana illegal, so Inez will have to vape it. She says she's never used cannabis before, but she's willing to try whatever might help the anxiety, insomnia, and pain that comes with MS.
I wanted to stay as well and healthy as possible for as long as possible.
In Sandusky, I'm Kevin Barry, News 5.
Business is growing for bud in Ohio. More than 17,000 people have gotten a doctor's approval to purchase medical marijuana to treat one of 21 state-approved conditions. Only News 5's Kevin Barry introduces us to the company that says it's written most of those doctors' notes.
Years of pain drove Samantha Mans to endure hours of January cold outside a medical marijuana dispensary, hoping marijuana would treat chronic pain in her knee.
I started with pain medication, and the pain would not go away.
Long before patients like Samantha can go to a dispensary, they have to visit a doctor certified to recommend medical marijuana to patients. One option is Ohio Marijuana Card, complete with marijuana leaf wallpaper and roughly 15 doctors in 7 locations around the state.
We're trying to get as many people in as we can get in.
Thursday, the Ohio Board of Pharmacy announced that more than 17,000 people had been registered, but the board won't say how many recommendations each doctor has written. Ohio Marijuana Card estimates that roughly 10,000 of those patients have passed through their doors.
They're not just early adopters, they're people who are really, really desperate to get on medical marijuana. They've exhausted all the different medications that you could possibly try.
A visit here is a little different than most medical appointments. Insurance won't cover these visits because marijuana in any form is still illegal under federal law. Before a patient comes in, Ohio Marijuana Card doctors get the patient's medical record, making sure patients have tried more traditional treatments before.
And that gives us a stronger argument that, hey, yeah, this is still kind of experimental, but the evidence so far has been good, and it's definitely worth a try.
That's why Ohio Marijuana Card says they only turn away about 5 to 10% of the patients who walk through their door. They estimate that they've written about 75% of the recommendations for patients allowed inside dispensaries.
Usually by the time they're in the office, we've already looked into their history a little bit and determined that they're at least worth talking to about trying marijuana.
While a visit to a traditional doctor often gives you options, the only reason to come to Ohio Marijuana Card is to get medical marijuana.
It does make sense to have medical marijuana be a specialty because knowledge is limited so far.
Ohio's medical board tells me they're aware of Ohio Marijuana Card, and they aren't concerned about how many recommendations that program of doctors claims to have written, as long as the doctors are abiding by the program patient care guidelines. In Columbus, I'm Kevin Barry, News 5.
Medical marijuana oils, lotions, and edibles are just around the corner here in Ohio. This week, the state's first medical marijuana processor is getting ready to turn raw marijuana flower into products that many patients have been waiting for. Only News 5's Kevin Barry explains why this step creates new challenges for patients trying to keep their families and their pets away from their medical marijuana.
More than 20 years of battling Crohn's disease pushed Mary Koenig to her wit's end.
It's been a heck of a journey. I've been through a lot. In and out of hospitals from the day I got diagnosed.
But she found she could keep the intense pain at bay with the treatment still getting off the ground in Ohio.
And the medical marijuana actually helped. And I'm like, oh my gosh, I didn't have any symptoms.
Until now, only raw marijuana flower has been available for patients to buy at dispensaries. But soon they'll have more options for how to consume their medical marijuana because of machinery like this.
The reality is what's in here is what we'll be able to plug into our products.
Josh Phoebus is the sales director at Grow Ohio, which is the first processor in the state to get permission to turn raw marijuana into medical products. So far, raw marijuana has been grown by cultivators and skipped over the processing stage so it can be tested and sold to patients in dispensaries. The only legal way to use that medical marijuana is to vape it.
Different forms are going to be better for different conditions.
Justin Hunt is Grow Ohio's executive vice president, and he says the state's first processed products like oils, tinctures, or edibles are expected on dispensary shelves from Grow Ohio in early April.
I like the varieties of stuff that we can do.
For patients like Mary, that means bringing new packages of medical marijuana home that not everyone might realize contains part of the marijuana plant that gets users high, called THC. Mary says at first, even she didn't think much about how she'd store it in her home.
I had no idea until I got it.
Mary's worked out a system where she keeps all her medication and medical marijuana in a part of her house where her 9-year-old knows she's not allowed to go, and on a high shelf away from her dog.
I just keep everything together, like I said, in my drawer or, on my shelf.
The packaging will help. The universal THC symbol is required on all packaging for products that have it. Then there's the safeguards built into the design.
With the tamper-evident child-proof, just like you would other medicines, other prescriptions, we want to make sure that kids can't easily get into this.
In Zanesville, I'm Kevin Barry, News 5.
Big price tags and no credit cards. Ohio's medical marijuana prices still getting off the ground.
And since the drug is still illegal under federal law, big banks are staying away.
Only on News 5, Kevin Barry explains how some of Ohio's newest dispensaries are offering customers an option other than cash and carry.
Long before Amanda Candow could even sign up to become a medical marijuana patient in Ohio,
they know what's going on at these places.
She was worried about being an easy target for criminals because of her MS.
You're going in with cash and you're coming out with marijuana. And I walk with a walker. I have bad balance.
Dr. William Cadia just opened 3 dispensaries under the name Terrasana, and he saw the problem too.
Cash. All comes down to carrying cash.
That's why Terrasana is using Hyper, an online payment app, helping customers take the cash out of the equation.
Strictly from a security standpoint, it's safe for the patient. They don't have to walk around carrying, cash. And for us as well, we don't have that cash burden to worry about getting into a bank.
It's also intended to make the payment process smoother. Patients can check in when they get to a dispensary, keep their account secure through a PIN code, and get their receipt on their phone when the transaction is finished. And it's not just the patients who are impacted.
I think until we have federal legalization, we won't see the big institutions step in.
Keegan Peterson runs a company that helps marijuana businesses pay their employees because the traditional financial companies are staying away.
I think a lot of federally FDIC insured banks have been fearful that they would lose their insurance if they do start supporting the cannabis industry.
Cadia says it's a problem that's not likely to be solved soon. Recreational programs in other states and medical marijuana programs like Ohio's have been set up through state legislatures, but marijuana for any purpose is still illegal under federal law.
That's the big bugaboo about the financial industry, is that I don't think they're going to touch this until there's some banking reform done at the federal level.
In Cleveland, I'm Kevin Barry, News 5.
A controversial new business is bringing new jobs to Ohio. The medical marijuana industry is allowing people to grow and make products that could have landed them behind bars less than a year ago.
In this News 5 original, Kevin Barry explains how the industry is helping Ohio's old manufacturing towns find new life.
We may never hear the tales these Lamser figurines have to tell in Zanesville's Old Town Antique Mall, but owner Jeff Snyder can tell you all about how thousands of jobs vanished in the 20th century as machinery became more efficient and people became less necessary.
Financial impact was devastating. I mean, because a lot of people went out, a lot of plants went out of business right away.
A short drive from the Antique Mall, an industry blending manufacturing and agriculture might help the community bounce back. Workers in other industries, some related to agriculture and some not, are finding jobs in the medical marijuana industry that just didn't exist a year ago. Before getting a job at a medical marijuana cultivation and processing facility, Rick Cozart made neon signs for more than 30 years.
It was very good up until about 10, 12 years ago when LEDs started taking over and putting a big dent in the neon.
Now he's a manager at Grow Ohio, working with people like Peggy Snyder. Before she spent years out of the workforce raising her kids, Peggy had a career in agriculture. And it was those years that laid the groundwork for her work in rooms now full of marijuana plants.
With medical marijuana becoming something that in Ohio that we can do now is fabulous. That's going to open a lot of opportunities for young people to get into.
Young people like Alex Greff. He graduated from Ohio University last year with a degree in plant biology and didn't know if he'd be able to stay in the state. But he found a job with Grow Ohio, and when the company's done hiring, they plan to employ nearly 125 people.
I thought at one point, I might have to move out west for that kind of opportunity, and things just kind of panned out the right way, and I got real lucky with it, and it's amazing.
Medical marijuana kept Alex close to home while giving new options to the whole community. These are high-skilled jobs. Workers have the chance to be promoted and make more than Muskingum County's average income. Pete Brokus is a retired law enforcement officer, now helping to grow the very product he used to try to keep off the streets.
I think there's some folks out there that have farms that, are maybe lacking or suffering. There's a place for them.
It's too early to see any kind of bump in the economic data since the medical marijuana program still isn't fully operational. But workers tell me they can see the difference even when they just go out to get a bite to eat.
Real local here, it's helped out some of the food places. It's picked up their income, what they're selling for lunch and stuff like that.
In Zanesville, I'm Kevin Barry, News 5.
Grow Ohio tells News 5 it initially hired industry experts from other states to get their business off the ground, but now it's looking to fill out the rest of the jobs with local hires who can learn to work in the medical marijuana industry. Patients now legally able to buy medical marijuana in Cleveland. The city's first dispensary opened today, nearly 8 months after the product was first sold in Ohio. News 5's Kevin Barry explains how this dispensary's location could change the perception of an industry.
It's taken doctor's appointments, recommendations, state approval, and months of waiting for a nearby dispensary to open before Nathan Myers could finally buy medical marijuana in downtown Cleveland.
This dispensary is so far away, if you don't have a car, there's no way to get there.
Many dispensaries in Ohio are in rural or industrial areas, but the one that just opened up in Cleveland is in the middle of a city block. It's in the heart of downtown, just a block away from Playhouse Square.
I came here because of the convenience of it. because it's close to home, because all the other ones are really far away and I don't have a car.
Now, Nathan is a bus ride and a short trip on his bike from getting the relief he needs. The location could also help with the stigma that medical marijuana patient Chris Busey knows all about.
It was always tough because I always would be like, oh, what's someone going to think of me? I'm not that stoner.
Chris changed his mind about medical marijuana when he realized it was a better option than traditional pain medications for his bodybuilding injuries. He hopes a location like this one could make other people more comfortable with the whole marijuana industry.
It makes it just feel like it's normal. You know, it's like a CVS on the corner almost.
Many of us in life, we only have what we know, what we think our values are.
Ohio State Representative Stephanie House agrees a location downtown helps fight the stigma against the whole medical marijuana industry. But she says the location is also an important part of making relief accessible to all types of patients.
Downtown on a bus line, that means everything to patients. You have accessible parking, parking lots, street parking, and I think that's one of the vital things when you think about access to health care.
Representative House says whatever reservations are left over are taken care of when critics can see inside the newly built or renovated facilities.
You know, this is not the vision of what you would have when we have heard about all the negative stuff, right? This is a clinic.
In Cleveland, I'm Kevin Barry, News 5.
And another medical marijuana dispensary is supposed to open in Cleveland near East 40th Street, but that one's been delayed by the state over a concern with that company's license application.
New numbers tonight on vaping-related illnesses in our country. 1,299 people have gotten sick, 26 have died, and Alaska is now the only state without a reported case. While the rush is on to figure out what's causing people to get so sick, it's making medical marijuana patients think twice about vaping.
Yeah, but those in the industry tell Kevin Barry their vaping products are safe in this News 5 original.
Headlines across the nation about vaping deaths and more than 1,000 people in the hospital with serious lung problems make medical marijuana patients like Alec Chenkis pay attention.
Obviously, it's concern.
But when Alec talks to other patients as the patient education manager at Ohio Marijuana Card, he says he's confident Ohio's vaping products won't make people sick. Dr. Umberto Choi has cared for patients seriously injured by vaping, and he says the main problem is that medical experts don't know what vaping products patients have used.
There are many different devices. The liquids are also not well regulated, so even from a factory it will be difficult to determine what's in there.
The FDA told Congress last month one substance that keeps showing up in these serious cases is called vitamin E acetate. Experts say it's used in low-quality black market vape products. But until that's confirmed to be the only thing killing some users and making many more sick.
What all these things have in common is the vaping itself. So vaping is definitely not safe and it's not something that we would recommend.
But Ohio's medical marijuana industry claims its products are safe. Companies that make vape products through the Ohio Medical Marijuana Program tell me they don't include any vitamin E or any material that doesn't come from the medical marijuana plants. Caroline Henry runs the Botanist dispensaries, and she says state labs make them proven.
Patients deserve access to products that have been tested, that are transparent, that are traceable, and that are highly regulated.
All products are tested by a third party, making sure everyone knows what's inside. Dr. Devora Nelson trains doctors who recommend medical marijuana to Ohio's patients, and she's concerned Governor Mike DeWine's call for the legislature to ban some flavored vaping products could scare patients away from vaping medical marijuana at all. She says vaping is one of the best ways for new users to take it because the effects are essentially immediate.
You get that relief. Your goal is relief. You reach your goal, you're done.
Her doctors warn patients to stick with the state-approved products and not try to save a buck by turning to the black market.
Yeah, well, $1 can cost you your life.
In Cleveland, I'm Kevin Barry, News 5.
Now, you can find the latest information about what the FDA finds and updates on Ohio's investigation into vaping illnesses under this story on our News 5 app.